Hello everyone, I'm Dr. Jimmy George K. I'm here to present a video about various obturation techniques. Many methods are used to obturate the canal with gutta percha and sealer. All the methods use the physical characteristic of gutta percha called plasticity or flow. Plasticity is inversely related to viscosity. It can be defined as the ability to deform and to flow away from a force directed at its mass. Each technique is designed to force the gutta percha to flow into the root canal, compress it against the canal walls, fill the tortuous axillary canals, and seal the various foramina exiting into the periodontium, and finally compact into a single solid core filling. In this video, we will be discussing techniques which are practiced in the clinical scenario. The first technique I would like to discuss is the cold lateral compaction technique. This has been one of the most commonly practiced obturation technique. Following the canal preparation, select the master gutta percha cone whose diameter is the same as that of the master apical file. One should feel the tug back with the master cone, suggesting a good apical fit. The master cone is notched at the working distance, analogous to the level of incisal edge, which is used as the reference point. Check the fit of the master cone radiographically. If found satisfactory, remove the cone from the canal and place it in sodium hypochlorite solution. If the master cone fits short of the working length, check for dentine chip debris, any ledge or curve in the canal, and treat it accordingly. If the master cone selected is going beyond the foramen, either select a larger master cone or cut the original master cone at the tip with a BP blade to get it to the correct working length. If the master cone shows S-shaped appearance in the radiograph, it means the cone is too small for the canal. In this case, a larger master cone should be selected to fit in the canal. Select the size of the spreader to be used for lateral compaction of that tooth. It should reach 1 to 2 mm of the true working length without binding in the canal. Dry the canal with paper points and apply sealer in the canal. Place the master gutta percha cone in the canal. Coat the pre-measured master cone with sealer and place it into the canal. After the master cone has been placed, place the spreader into the canal alongside the cone. The spreader helps in compaction of the gutta percha cone. It acts as a wedge to squeeze the gutta percha cones laterally under vertical pressure. It should reach 1 to 2 mm of the prepared root length. Remove the spreader by rotating it back and forth. This compacts the gutta percha cone and creates a space for placing axillary cones lateral to the master cone. Place axillary cones in this space and repeat the above procedure until the spreader no longer penetrates beyond the cervical line. Now sever the protruding gutta percha points at the canal orifice with a hot instrument. Now let's watch a brief video describing the lateral compaction technique. Place the master cone coated with sealer in the canal. Place the spreader alongside the master cone. Place axillary cones into the space created by the spreader. Repeat the procedure till the spreader no longer penetrates beyond the cervical line. Now cut the protruding gutta percha points with a hot instrument to the level of cemento-enamel junction. Condense the gutta percha points with a hand plugger. Limitations of this technique are the presence of voids in between the filling and an increased sealer gutta percha ratio when compared with the thermoplasticized techniques. Hence, we have reached the conclusion of the video. In the next video, we will be discussing warm vertical compaction technique. Till then, stay tuned.